Hi everybody, today I'm going to do a video of the spinal column, also known as the vertebral column. And as you can see, there are different curves to the vertebral column. This would be the kyphotic curve, which is present at birth. When you're born, you only have a kyphotic curve. But then as you raise your head, you get this curve right here, in the cervical, and then lordosis curve down here. And the spine is made up of a few different parts. There's the cervical part right here, where there's 7 cervical vertebrae. Then you have a thoracic section here, thoracic vertebrae. There's 12 of those. And those are what the ribs articulate to. And down here you have the lumbar vertebrae, and there's 5 of those. Down here you have the sacrum, which is composed of 5 vertebrae when you're born, but they all fuse together just to form the sacrum when you get older. And as well with this right here, the tailbone, which we call the coccyx, and that is comprised of 4 fused bones together. So we'll go back up here and go to the first cervical vertebrae, which is called the atlas. And it's called the atlas because, like in Greek mythology, Atlas was the character who held up the globe, right? Well, in this case, the globe would be the skull, or occipital bone, where it articulates to up there. And some of the movements which occur here would be, the most important one would be the flexion and extension, which would be like if you're nodding yes. That's what would be in that joint in there, most responsible for. And just down below it, that was the atlas. We have then below that the axis, which is more responsible for rotational kind of movement. So that would be like shaking your head no, right? And there's a structure in here which is called the dens, which is like a bone that which pivots, which the C1 would pivot on, like that. And if you had like a severe whiplash, sometimes that dens can break off and you essentially would die. Or it wouldn't be good anyway. If your dens broke off, it would most likely get lodged in your spinal column, and that wouldn't be a good thing, right? So you have the C1, the C2, the atlas and axis, and then below that is C3, 4, 5, 6, 7. And this is where there's a lot of movement which occurs. So obviously with the neck, you're able to look around, which is an important evolutionary aspect of our body. We can look around maybe for predators. Back in the day, that'd be something to our advantage. But below that, we now get into the thoracic vertebrae, which are more, there's not as much movement. There still is a little bit permitted, some flexion and extension and such, but not as much as the cervical. And as I was saying before, this is where ribs articulate with. An important feature of all vertebrae, especially these ones, are these spinous processes, we call those. If you look on this side, these ones are slightly pointed down. And up here in the cervical one, there's even ones which kind of have 2 little processes coming out. And so here the spinal column, these are the spinal processes, and then on the side there's these, which are the transverse processes here. And this will move down. Say that was a kyphotic curve in your back right here, the one that's like this. And we'll go down to T12, and then we'll get into the lumbar section, which are much more, as you can see, the bodies are much bigger than the ones up there, if you can see in there. And obviously, it's better to have a bigger base, right? If you're going to build a structure, you want to have a strong foundation. Well, that's why there's bigger bodies on the lower vertebrae down there to hold your weight and support you. And kind of a unique feature of these ones is it has another kind of process that sticks out, which is like a mammillary process right here. Still has the transverse ones, but as well another one which the upper cervical and thoracic vertebrae don't have. And in between, if you were to get right in the middle of there, that's where the spinal cord would be, running straight through. And obviously that's important for all motor functions in your body, movements, as well as sensory functions. Information coming from your touch towards your brain would travel up into your brain up here. So if you were to get an injury and sever your spinal column up here, you'd be paralyzed all the way down. That's why quadriplegics, people who can only use their face to talk or look around, but they're not able to use their body at all. That's where they might have severed the spine up here. But someone who's who's a paraplegic as opposed to quadriplegic, they might have had severed the spine down here. So from their waist down, they might not be able to walk, but they could still move around and use a wheelchair, for example. And well, I guess the important thing I should mention is the ribs, which they, as I was saying, they articulate with the thoracic vertebrae here, although not all of them do. As you get down, there's false ribs, which are ribs number 8 and 10, as well floating ribs, which don't articulate with anything. They're just held there with muscles, ligaments, and fascia, connective tissue. All right, so the lumbar vertebrae down here, and that's lordosis curve. You might have seen some people who have really severe curve down there, hyperlordosis, which can cause a lot of back issues. And there's also, you can have the opposite, but that's not as common. And then down here is the sternum. Wait, no, it's not the sternum, it's the sacrum, sorry. The sternum's up in front by the ribs. This is the sacrum. And some people actually have an extra vertebrae here. I know people who have RH blood types sometimes would have extra vertebrae there. It's just kind of, you know, nature sometimes is diverse, and the human bodies between us, we can have different features. Some people have extra muscles, some people lack muscles. So there's a bit of variance between, even within human species, there's some variance in what we have and don't have. So down here is the sacrum, and there's these holes, which are the sacral foramina, and there's a ridge here. And you get down to the tailbone right there. Obviously, if you fall hard on that, you can break your tailbone. That's not be able to sit right for a few weeks. And yeah, that's about it I'll have to say about that aspects of the spine. We'll move around front and to the ribs. And they articulate. Well, they actually have a cartilage section here. So this is the actual rib bone, then it turns to cartilage right here, which then articulates with the manubrium, the sternum, and the xiphoid process. So the sternum is where you would do CPR if you need to resuscitate someone. And there is some slight movement when you breathe that goes on here, not much. But there is a bit of movement between the ribs and the sternum at the joint there. And then there's the xiphoid process here, which if you're doing CPR you want to avoid, because if you break that off, that can be dangerous. Although, like I was saying before, there's a lot of variance between people in the human species. Some people don't even have that, well, which is kind of blows my mind, the fact that some of us have one bone and some of us lack it. Well, a lot of people don't have that, so you can check it on yourself. And if you follow your ribs up above your belly button towards your sternum, you can feel a little bump there in between. I got one. It's pretty predominant, but some people don't. And well, maybe I wasn't going to get into this, but I guess I should mention that some of the muscles that we have on the back, the major ones would be the rectus spinae group, which run all the way down along the sides, which are really good in massage. That's an area where people like to get really deep massage work done around the rectus spinae group, and then from here all the way up to there. There's also the trapezius muscles that are up here, the rhomboids in there, which attach from the scapula, that medial border, to this to the spinal processes. You got levators right here, which would raise that scapula up. Levator scapula would be right here. Oh, sorry, touches here to here. And yeah, also a lot of other postural type of ones that connect all up here. Like the multifidus, for example, that's one. It just attaches from the ribs to the spine right here, and it's just a support structure. As well as serratus muscle, serratus posterior inferior would be down here, kind of does the same thing, and serratus posterior superior would be this one up here. It's like a fan-shaped muscle that attaches these groups together. And as well the rhomboid, or yeah, I already talked about the rhomboids, those are up here. But the latissimus dorsi, it starts from down here, attaches to the rib, attaches to the bottom of the scapula, and yeah, that's all I have to say about that. If you have any comments or questions, please leave below, and thanks for watching.